for Advantage Athletic Therapy in Simcoe, Ontario. And today, Mr. Therapist, we're going to talk about common questions you get. It's a test. Can you handle it? Are you ready? I know you're just chomping at the bit to get these questions, right? Are you ready?
I'll do my best. Yeah, let's hear it.
All right. So these are the most common questions that physiotherapists get asked, and we're going to see how you do.
Now, don't forget, we're athletic therapists, not physiotherapists.
Oh, well, then we'll better throw this all out. We better start over. No, we're going to ask them anyway, because you should be well-rounded by now. You've been doing this job a long time. How many years?
That's my 4th year.
All right. So, yeah, you should be good, though. Does physiotherapy reduce pain?
It can reduce pain, of course. It's not going to be a light switch that you're turning on and off, but with following programs and coming into the clinic, it can certainly help reduce pain.
Is physio painful?
It can be painful, yes.
In which aspect? Just depending on
in terms of like
injury?
Working out, if you're working a muscle and you're applying pressure and there's no pain to that area, usually that means that there's nothing wrong with it. If you're working, let's say you find a trigger point in somebody's upper trap, like working through their shoulder and trying to release that tension, us applying pressure through that can be painful. But of course, we speak with our patients and communicate tolerable pain levels, as well as we don't want to push the boundary of like creating damage. We're just trying to reduce, typically it's tension.
Okay. What conditions do you treat?
A little bit of everything, to be honest. We have patients that come in with sore backs from standing at the counter during canning season, which is right now, which seems like a non-athletic injury, but we do treat patients like that. We have acute injuries like ankle sprains, or coming back from being in a cast. There's a large variety of injuries that we treat.
Correct. You got that one right. Does insurance cover physio?
It can. It depends on your specific provider. In our region, OPP and elementary school teachers have athletic therapy coverage.
Oh, cool. Do you need a referral?
You do not need a referral to come into the clinic. No.
Oh, I didn't. Okay, that's good to know. Can I bring somebody with me to my appointment?
Of course. I have patients that are younger. They want to come in with mom and dad, feel a little bit more comfortable in the space. I've also treated patients that have brought in 4 children with them because something happened at home and it's a little bit of an emergency, and no problem at all. We can make it work.
What's your recommendation that folks should wear to a treatment?
It depends on what we're working on. If we're working on lower body, shorts is always recommended. It can be done with like tights, something close to the skin. It's just better to work skin on skin contact. You get better results. And then if you're doing something upper body, especially shoulders, not wearing like a heavy sweater that can't be removed is always beneficial.
Okay. And how many sessions do people roughly need?
That depends on what's going on. Some patients will use it as a maintenance type thing where they'll come in every 4th week or every 6th week as like a little update, kind of figure out, okay, this has been a little nagging injury here or there, keeping everything nice and smooth. Or an acute injury, like let's say an ankle sprain, they have a volleyball tournament that they're looking to get back to, then we're going to look and be like, okay, game day here, tournament here, this is what we're kind of going towards. Then it was going to be more frequent, probably 2 to 3 times a week, typically 2, and then it's just what best suits that situation. It's not a recipe or like a cookie cutter. It's very individual.
And how do I know if I need to see how do I know if I need treatment? Like what are the parameters? My shoulder's sore. Like what's the guidelines there, I guess?
The way I look at it is typically if there's pain that's something unusual than what you typically feel, and it lingers and you're unable to have any change in that pain, or if it's affecting your ADLs, which is your active daily living. If, for example, you're starting to find it difficult to put on a shirt in the morning, or like have your hands above your head, or even something like brushing your teeth or standing at the sink, if those normal activities start to become painful, or you start to become aware and maybe even avoiding them, then it's time to come in. Or if it's something super obvious, like, I don't know, you drop something on your foot and you're like, oh, that usually would get better after a day or two and it's not getting better, come in, take a look at, or a rolled ankle, something like that.
This is the last question. How, with you and Paige, how do you help folks maybe that struggle with anxiety or anything else like that when they come in for a treatment? Is there sort of a protocol that you guys follow?
I think we just try to be as welcoming as possible. Try to establish a good concept of communication, and kind of seeing how patients would like to be treated. Some patients want to talk, some patients don't want to talk. Some like the lights down low. We have a dimmer for that reason. We also have we can use like some essential oils to like bring in a nice smell, something that's going to be comforting. That would be my biggest thing, is making the patient comfortable, using communication. I think that's definitely number one. And once you establish that and you kind of understand, then you're better able to suit their needs.
It really boils down to that trust factor too, doesn't it?
100%. And letting people know that like what happens in the clinic stays in the clinic. We're not going to be speaking about what you told me and I'm going to tell another patient, or even somebody that they know, like friends and stuff like that. It stays within the confines of the clinic.
One of the things that I always appreciated is you guys always told me before you did it. You know, you sort of prepared me. So this is what we're going to do to your shoulder. Here's how you're, you know, and I think that sort of takes away any fear or anxiety that you have. And I guess, again, it's that trust factor, correct?
Yeah, and what we're establishing there is a form of informed consent. So it's a lot different for me to say like, Dave, I'm gonna work on your shoulder. We're gonna do this. It's like what we want to do is explain why. Maybe some of the contraindications of, well, if you have this, then we shouldn't go through with it. Some of the risk factors, some of what you're gonna feel the next day, and then that helps establish that rapport and that trust. And then also giving your benefits, which is a number one thing I think when it comes to, like we talked about, sometimes therapy can be painful, but it's looking to get out of it more than what you're feeling in that moment. So it's a little bit of short-term pain for long-term gain, essentially.
Okay, bud, you got 5 stars today. You did a great job, young man. Keep up
Well,
the good
thank you.
work.
Studied hard for this one.
That's our show for today, folks. And you know, I wanted to get those questions out because they're obvious, and you know, but because they're so obvious, you do need an answer, right? And people are sometimes intimidated to book that appointment or make that call.
Well, and then Dr. Google also gives a lot of varying opinions, which can sway people. And sometimes it's coming from a certain source that wants to be swayed in that direction. So it's always easy to come in, get checked out. And then if you don't have to come back, that's perfect, right?
Yeah. Take care. Have a great day.
You too.